Yesterday, when I heard the numbers, I was afraid. When I heard the potential modeling that the doctors put forward, I was afraid because these aren't just numbers. If there is increased rates of infection, if there's increased rates of transmission, all that means is more people are going to get sick, and that means more people will die. And it's hit me differently because yesterday, on the front lawn of Parliament, long-term care activists put over 2,000 empty shoes on the lawn. And those shoes represented loved ones that were lost, because these are people that we're losing. These are our loved ones. These are our parents, our grandparents. And I met a young girl. She was there with her dad. And she said she lost her best friend. Her best friend was her grandmother. That's what we're up against. So I absolutely support the call to ask people to stay at home. But it is completely out of touch to just tell people to stay at home unless we actually provide support for people to stay at home. It's also out of touch to just tell people to stay at home if we ignore that there are so many people that are essential workers that have to leave their home to go to work. They don't have a choice. They have to leave their home to go to work, to put food on the table and to do those essential jobs. So it is out of touch to not say to those people, we are going to do everything we can to keep you safe when you go out of the home to go to work. So what we need to do right now is make it easier to get help. We are in the second wave of COVID-19, and it is harder to get help now, even though things are worse than it was in the first wave of COVID-19. We know that in the first wave of COVID-19, when we helped people stay at home, it worked. We were able to flatten the curve. We also learned that long-term care homes were the site of the worst impacts of COVID-19. It is inexcusable that they are still the worst sites of outbreak. We should have learned this. And I put the blame clearly on government, specifically the Liberal government. Prime Minister Trudeau knew this, knew that this was a problem, and has not acted to save our seniors. People that are living in long-term care homes need help immediately. We sent in the army. It is inexcusable that there are still so many outbreaks in long-term care homes. So we need to do a couple of things right away. We need to give help to people, make it easier to get help. If someone is sick, they need to be able to stay at home. We need to help people stay at home. And to workers that have to go to work, we need to make sure they are safe. We need to do these things immediately. And we need to do this to save lives. Quand j'ai reçu les nouvelles, les chiffres par les médecins hier, ça m'a fait peur. Ça m'a fait peur parce que ce n'est pas seulement les chiffres, c'est les êtres humains. S'il y a plus de cas, si les nombres de cas de la COVID-19 augmentent, on va avoir plus de gens qui vont mourir. Et hier, des militants pour améliorer les conditions dans les centres de soins de longue durée, ils ont mis plus de 2000 souliers vides devant le Parlement pour montrer que ce n'est pas des chiffres, ce sont des êtres humains, ce sont nos proches. Il y a une petite fille qui était là avec son père, a dit qu'elle a perdu sa meilleure amie. Elle a perdu sa grand-mère. Donc, j'ai peur pour les gens. Donc, j'appuie complètement le conseil de rester à la maison. Mais on ne peut pas rester à la maison si on n'a pas l'appui pour le faire. Ce n'est pas réaliste. Ça nie la réalité si on ne donne pas l'appui pour les gens de rester à la maison. Et aussi, c'est essentiel qu'on reconnaisse qu'il y a plusieurs personnes qui ne peuvent pas rester à la maison. Ils doivent travailler pour joindre les deux bouts, pour faire le travail essentiel. Pour ces gens, il faut s'assurer qu'ils sont sécuritaires. Donc, ce n'est pas seulement quelque chose que les individus peuvent faire. Il faut que les gouvernements fassent leur travail pour aider les gens et pour rendre les milieux de travail sécuritaires. Et finalement, on savait que pendant la première vague de la COVID-19, ça a fonctionné d'aider les gens pour rester à la maison. Deuxièmement, on savait que nos centres de soins de longue durée étaient les plus frappés par la COVID-19. Donc, c'est inexcusable que ça continue. Et je mets la blâme sur le Premier ministre Justin Trudeau. Il savait tout ça et il n'a pas agi pour protéger nos aînés, pour protéger nos proches dans les centres de soins de longue durée. Donc, il faut agir tout de suite. Il faut suivre le conseil des experts en matière de santé publique, mais il faut aussi faire le travail d'aider les gens pour suivre les conseils des experts en matière de santé publique. Merci.
Nous allons maintenant prendre les questions, commençant par les questions au téléphone. Comme toujours, une question suivie par journaliste. We'll now take questions, starting with questions on the phone. As always, one question, one follow-up per reporter. Operator, do we have a first question?
Yes, we do. Nous avons Stephanie Levitt from the Canadian Press. À vous la parole. Please go ahead.
Hi, Mr. Singh. Thank you for taking the question. I wanted to ask, you're out here today and you're addressing what the government, ought to be doing, how they ought to be responding. I wonder what role you see for yourself in communicating the public health message that the government is urgently trying to stress today. There's a line between, holding the government to account, but also speaking directly to Canadians about what needs to happen here. You have a platform, the Prime Minister doesn't. You speak to a different audience. And yet we don't see a lot of opposition leaders really trying to hammer home the public health element of all of this.
Not at all. I absolutely believe that the public health advice to stay at home is essential. But what that public health advice has to be coupled with is an understanding of the reality that people are faced with. Absolutely, people need to stay at home. But how does one stay at home if they don't have help to do so? We saw it worked in the first wave of COVID-19. People stayed at home, but they had the access to help. And secondly, there are a lot of people that can't stay at home. So what does that advice mean to someone who is an essential worker? It doesn't mean much. So what I'm saying very clearly is we need to follow the public health advice, but that public health advice can't be put forward without the supports needed to follow that advice. That's very vital. It is almost meaningless to suggest one thing without giving help to achieve that. So we're saying to workers, you've got to stay at home. Well, they can't stay at home. So they need help. And we're saying to people, stay at home, but it's harder to get help now than it was in the first wave. That's what I'm talking about today. We need to follow the public health advice, but it is not connected to the reality. It is out of touch to say that without giving people the help to do that. And we did that in the first wave. And that's what I'm talking about today.
I mean, I guess just as a follow-up, though, I'll be more explicit. Like, I take your point that it's meaningless to give that advice without the supports, and it's up to the government to provide the supports. What I'm asking is, we don't see folks like yourself, Aaron O'Toole, Mr. Blanchette, actively just communicating the public health part. You focus a lot on critiquing the government. That is your role as opposition. But what about your role as leaders in society to help reach people, to hammer home the need to follow these public health measures?
Oh, absolutely.
Like you love TikTok. Why not do a TikTok about washing your hands? Do you know what I mean? Like that sort of thing.
No, we've done multiple. Maybe you need to double check my TikTok, but we've recommended and advised people to stay at home. Absolutely, I've done that multiple times. That it's important to follow the public health guidelines. I support the science. I mean, there's nothing partisan about the science and about the advice we're receiving. I think in that way, as a nation, we are far better off than other countries in that we absolutely are supporting and need to support the advice given by the public health officials. And I support that, and I'll continue to advise that. But my job is to make sure that that's followed, is to make sure it is actually in touch with what people are going through. And so if public health advice doesn't connect with people's reality, then I have to stand up and say, well, this is important advice. To achieve it, government has to step in and provide these supports. And that's what we've done throughout the pandemic. Anytime there was an initiative and we saw that that's actually not going to help people the way it needs to, we push for changes. Small businesses right now are hurt. We said from the beginning, the Liberal approach, which was to give help that it was tenant-based or landlord-based instead of the actual businesses applying, was fatally flawed from the beginning. And these are the type of things we need to point out. So we are very focused on making sure people are healthy. I'm focused on that. And I want people to follow the public health guidelines, but they have to be supported in order to do so. And that's what the message is today for me.
Opératrice, prochaine question.
Thank you, merci. Please press star 1 at this time. N'hésitez pas à appuyer sur étoile 1 maintenant. We have no further questions. Nous n'avons plus de questions.
We'll now take questions from the room. Nous allons maintenant prendre les questions de la salle. David?
Hi, Mrs. Singh. David Thurton from CBC News.
Hey there, David.
So what further supports are you calling on the government to offer? Because CERB has transitioned to the enhanced EI. There's recovery benefits and that kind of stuff, and you fought for that and you claimed victory for getting that. So can you just tell us maybe what further do you want to see? What are you proposing? What are you putting on the table that the government specifically needs to start doing now?
Thank you for the question. As we're seeing the numbers increase after yesterday, things changed for me yesterday. When I saw the numbers and they were put out today, we are in, it's not like we were just transitioning along, things were difficult. There's certain sectors that are going to be hard hit, and a transition would be okay because it's going to focus in on some of the sectors like tourism and hospitality that are faced with increased difficulty in returning. That's one thing. But looking at the numbers yesterday, what has changed for me is that we are at a critical moment. Like, things are very scary. And when we're at a level where things are that scary, we just had the representation of those 2,000 emptied shoes that reminded us these are people that we're losing. I'm thinking about communities that are hard hit. I'm thinking about people that are going to lose their loved ones. Knowing how bad things are right now and knowing that there is an end in sight, there is a potential, a lot of great potentials around vaccines. If we don't act now with the full force that we acted with at the first wave, if we don't act now with that same full force, we're going to lose a lot of people. And after seeing those numbers, what changed for me is that we need to actually make it easier to get help to people. It is harder still, and it's limited still. We need to get back to a point where anyone who needs to stay at home can get that help right away. We need to change that. We need to make sure we are redoubling our effort. Imagine right now, we're at this point, and if we don't act, that we see those numbers, the 60,000 worst case scenario, or even the 20,000, which is if things stay the same, that is going to mean thousands of people die. So given that urgency, I am saying we need to put everything back on the table. It's only going to be for a short time because we know that there's a potential vaccine, positive signs in the future, but we need to do everything now to keep people safe. And I don't see that urgency. That urgency means putting in place the same supports that were there in the first wave that worked. Let's use what worked. If it worked in the past, let's do it again. And I'm saying everything should be on the table.
Okay, I'm still not clear what exactly should be on the table, but can I ask you this? You raised yesterday that you had deep concerns about what was happening in Brampton, specifically the cases and the state of the situation there. What do you think provinces, what do you think premiers need to be doing right now? Because the response isn't just at the federal level, it's also at the provincial and territorial level. So can you talk about that?
Absolutely. And I think there's been a complete abdication of responsibility on the part of Premier Doug Ford. Without a doubt, he'll come out and make announcements, but he has not put in place any funding to help people. He sat on dollars that have been presented, that have been delivered by the federal government. Due credit, the federal government has provided funding. The Conservative government in Ontario has done nothing with it. They've not spent that money on helping people. And we're seeing the hardest hit people are the essential workers, people that can't stay at home, people that have to go out and work. And we know that in regions like Brampton, that's where we have the essential workers that bring the food to grocery stores, that provide the transportation, that work in the factories, that package and ship the supplies that people need. So these are the most essential workers that are the most at risk, that are getting the highest rates of contraction. And we've got a provincial premier that's doing nothing. And now we've got an announcement today about how serious things are. And I'm saying what we need to do is what worked in the first wave has to be applied now. We need to have an easy and quick, accessible way to get supports to stay at home. It's not easy. It's not accessible. The support that we had advocated for is not as easy as it was in the first wave. We need to make it as easy. We need to make sure that people that are going to work get all the support they need to be safe and to be healthy. Those things are not there. We need to learn from what worked in the first wave. Everything that worked was to give as much help as possible directly to people so they could stay at home, and to acknowledge that people who can't stay at home, they need support. They don't need to be blamed because they're frontline workers, they're essential workers. They need support and help to stay healthy. That's what I'm asking for.
One last time if we have another question on the phone, Operatrice.
Bon, so, pour l'instant, there are no questions on the phone.
Do you have more questions?
Yes, Mr. Singh, I'll just ask you a quick question here. We've seen calls from other parties and even, non-political leaders that there needs to be an all of government, of all leader approach, something like an intergovernmental task force that includes the experts. I can't help but think that yesterday's briefing that you had with Dr. Tam was somewhat like that. Is that something that you would like to see? Is that something that you would like to see where, all of our federal and provincial leaders are at the table at some point in time and you all are making decisions together and plotting the direction and the path that we're taking to flatten the curve?
There's always merit in finding better ways to work together. So I support that broadly. But what I want to see is the action more so than working on a task force. And there's an urgency right now, and we need to move with incredible speed. And instead of thinking about long-term planning, there are some immediate steps that we can take right now that will work. And I'm saying let's just do exactly what we did in the first wave. When we wanted people to stay at home, and it was the right thing to do, we put in place great support to help people stay at home. Right now, it is harder to get help. It is demonstrably, measurably harder to get help to stay at home now when things are worse in the second wave than it was in the first wave. That has to change. And I'm not prescribing the specific solution, but it has to be easier for people to get help to stay at home. If we're asking them to stay at home, we have to provide that same urgent level of help. If it's an urgent call, which it is, then the help has to be urgent, and it is not urgent help. That's my problem. Secondly, it's the workers that have to go to work, that have to continue to work, are the ones that are the highest risk, that are getting exposed, that are putting their lives at risk and are putting their families' lives at risk. These workers need immediate help. So there needs to be an immediate response to get people the PPE, to get people the safety in their workplaces. And for that, we don't need to study it. We know what needs to be done. And I just want to see it done immediately. Governments know what needs to be done. The evidence is clear. Public health officials have made it very clear. I need to see that immediate action to respond to the urgency of the crisis that we're now faced with, given the new numbers that have come out.
Thank you. This concludes the press conference. C'est la conférence de presse. Merci.
Thank you.